If your child's recently been diagnosed with an autism spectrum disorder and you don't know what to do next, watch these videos. Welcome to the frozen tundra that is Iowa. In the winter, yesterday the high was -3. And I'm shooting a video today because I want to talk to you about what to do next with an autism diagnosis. Hello everyone and welcome to the channel, where we endeavor to educate, equip, and encourage anyone raising a child with a disability or behavioral difficulty. I'm Dr. Noble. Let's get started. He's walking. He's walking. He's a good guy. So here we are on a frozen lake in northern Iowa where the high is -3. I wanted to shoot these videos in the frozen tundra because I think it reflects a lot of what most of you are going through. If you're watching these videos, your child's been recently diagnosed with an autism spectrum disorder. And that can be really scary because oftentimes people don't know what to do. If you haven't seen my previous video about early intervention services, start there. I'll link it above. Oh, my ears are starting to freeze off. I gotta speed this up. I could wear a hat. Yeah, I could. But then you wouldn't get to see my bed head. Today I want to talk to you about the necessity of private therapies and services. Let me explain what I mean. Private therapies and services occur in addition to the therapies you're already receiving through early intervention. Now, early intervention provides you with speech, occupational, and physical therapy supports at home or in daycare, typically for children under the age of 3. Once you get over the age of 3, those services then transition to early childhood special education and eventually school. Now in this video, which is the second part of a 5-part series, you're probably thinking, Noble, why do I need more therapies and services? I'm already getting them through early intervention. Listen up. While private therapies and services aren't better than what you're receiving through early intervention, they're different. Whew, that's a lot better. Now my ears aren't gonna fall off. Well, they still might fall off. Private therapies and services aren't better than what you're receiving through early intervention. They're just different. They have a more medical emphasis, which can be really important to help your child be successful not only at school, but in the community. Private therapies and services typically starts with speech. Speech therapy in a child who's recently been diagnosed with autism is among the most important therapeutic interventions to provide your child because we have to build in them the ability to effectively communicate. If I had to summarize an autism spectrum disorder based on 20 years of experience, it would be a diminished intent to communicate. We have to help children understand that communication is necessary in order to get what you want. So adding a speech therapy evaluation on a private basis is really important because it begins the process of building intent to communicate. Maybe it's using sign language or a picture exchange schedule, or just making a choice between 2 objects, or holding your arms up which is saying, pick me up. Private speech therapy will begin that process, and it typically occurs once weekly, anywhere from 30 to 45-minute sessions, sometimes with just a speech therapist, sometimes with a speech therapist and other therapists, such as occupational or physical, because co-treatment can often lead to better outcomes and a more efficient system. While private therapies and services are medically based and important, it's also important for you to know that unlike early intervention services, private therapies are typically not free. I'm going to air quote free. And what I mean by that is they're billed to your primary insurance company, which may have discrepancies on what they choose to cover. I've seen some therapy groups that will only cover 26 speech therapy sessions a year, which last time I checked, there's 52 weeks in a year. That's not even once a week. So oftentimes, you need to check with your primary insurance company to see what they'll cover, but more importantly, what they'll cover in terms of diagnosis. Sometimes autism as a diagnosis qualifies you for speech therapy. Other times, autism alone does not cover you for speech therapy, and additional diagnoses are needed. Those diagnoses typically include a receptive and expressive language disorder. If you don't see that on your diagnostic list that you're using to bill insurance to access speech, you need it. Now, your primary physician can link that order for speech therapy to the diagnosis of a receptive and expressive language disorder, or just expressive, or just receptive. It doesn't matter, but there needs to be something more often on the diagnostic list than just autism. The next private therapy to consider is occupational therapy. Now again, you're getting some occupational therapy through early intervention services. This is occupational therapy on a private basis, which is more medical in its emphasis. Occupational therapy does a lot of things for children with an autism spectrum disorder. First and foremost, they can work on things like some of the adaptive skills that are necessary to be successful and eventually independent. What do I mean? pincer grasp, fine motor grip, buttons, zippers, tying shoes, brushing teeth, washing hair, the adaptive daily living skills that are often needed, that often need to be demonstrated in children so that they can make progress towards adulthood and eventually independence. Occupational therapists do a lot of things, okay? It's not just the adaptive measures. Oftentimes they provide therapies towards the sensory environment that children with autism often struggle with. Bright lights, loud sounds, sub-zero temperatures. These kinds of things can be very difficult for children with autism to navigate. Occupational therapists can provide interventions that will help lessen the sensory burden that these children are often struggling with. Not only that, oftentimes occupational and/or speech therapists can work to help diversify the diet. Children with autism spectrum disorders often struggle in what they're willing to eat, and speech and/or occupational therapists can help with feeding therapy to diversify the diet. Lastly, private therapies and services can include physical therapy, and that's the big motor groups. It's the crawling, the sitting, the walking, the climbing steps, the jumping, the coordination issues. These are things that often can be difficult or hurdles that individuals with autism need to overcome. Sometimes it's just to look at toe walking. Individuals with an autism spectrum disorder often demonstrate toe walking, not always, but often. And sometimes they do it to such an extent that it begins to create structural problems in their heels and in their calves, and that is best addressed by the assistance of a physical therapist who can help bring those heels down. It's important that as soon as a diagnosis of autism has been made, referrals for these services, PT, OT, and speech, in addition to the early intervention services, which we talked about in our last video, are made immediately because there's wait lists for all of these things. A speech therapist on a private basis is typically not going to provide therapy for a child who's under the age of 24 to 26 months unless they have a suck-swallow problem, a feeding difficulty, or something like that. But in terms of just functional communication, usually that starts at 26 months. That being said, oftentimes speech therapists have a wait list that can be extravagantly long. It can be a month or two before they do the evaluation. It can be several months before you receive a therapy slot. It may be true for physical and occupational therapy as well, which is why it's important to make these referrals right away, even if you're not ready to receive them, even if you don't know how it's going to work in your community. There's a semi. Nope, didn't honk. I'm out here, didn't honk. Even if you're not sure how it's going to fit into your work schedule, just get the referrals made and then decide later. Remember, you can always make a long rope shorter. We've got more videos. If there's any benefit to this at all, please like, subscribe, and hit the bell, and send this to your friends because there are 19 million children in America with special health care needs, and they're all on wait lists. Watching these videos will allow you to skip the line. Thanks for watching. More to come.